Nancy, it's a pleasure to meet you. Thank you for joining me here
Thank
today.
you.
I was so interested to hear your keynote speech. The American Heart Association is kind of jumping in with both feet to this idea of precision health. Why has this been a priority for the AHA?
You know, for the AHA, the focus on precision health has been a top priority because every single day we see patients and consumers who are facing really serious health challenges and health issues. And we're committed to take all of the resources of the AHA and the science capacity of the AHA to find answers to those questions.
And you actually recently established a partnership with Amazon, is that right?
Yes.
Tell me a little bit about that.
Yes, the American Heart Association and Amazon have actually created a strategic business relationship to provide new tools and solutions in the area of precision medicine and precision health. We've created a data discoverability platform that allows cohort studies, companies, academic institutions to keep their data in their own secure cloud, but put it in the AHA Amazon data discoverability cloud so that there can be sharing among and across data sets. We believe this will really accelerate outcomes because it will take away the barriers of access to data from other studies.
So it's an interesting idea to have kind of the private sector be involved in this. And I think some people would say that maybe there are some concerns, you know, what does Amazon want this data for? And what do you tell people who have those concerns?
Yeah. You know, here's the bottom line. As science organizations and as not-for-profit organizations like the AHA, we each have certain types of capacities. Technology companies have amazing capacities, and I'm convinced that the acceleration of cures for patients will come from this integration of people who know how to do things that we don't know how to do, working with those of us who know about science and medicine. And so together, the AHA and Amazon make a wonderful couple because they have this amazing ability to create technology solutions that are easy to use. Think of the Amazon marketplace where, you know, I don't know about you, but almost every day there's a box that shows up at my house from Amazon. They've made that access easy.
Yes.
And that's what we're trying to do with data. And there was nobody but Amazon really in our mind that could help us do that.
They certainly manage a huge amount of data and physical merchandise, so it sounds like a logical partner.
Yes.
Tell us about the One Brave idea.
Yes. You know, we're so excited about One Brave idea. Our research enterprise with Verily and AstraZeneca and the American Heart Association, each of us have contributed $25 million, so $75 million total, as well as other resources of our organizations, the great computing capacity of Verily, which is a Google company, you know, all of the information on drug discovery that AstraZeneca brings and all the scientific resources and the patient resources of the AHA. We've given this award to Dr. Callum McRae from Brigham and Women's Hospital and Harvard University and his amazing team of collaborators. And together we are looking to understand this transition from wellness to disease. What is it in a person's genes, in their cells, in their environment that causes people to develop coronary heart disease, and are there new diagnostics, new tools, new protocols that could identify that earlier so that we can help create both scientific solutions as well as solutions in terms of interaction between individuals and their environment and their healthcare provider that might allow people to live longer lives.
I think one thing you mentioned that I was particularly interested in is this idea of, are we asking the right questions, how to make the data work for us? And you know, as a physician, we get a lot of data from our patients, and some of it is relevant and some of it's probably noise. How do you think that an initiative like this will be able to help us not just get more data, but use that data in a more kind of logical, streamlined way?
Yeah, we, through One Brave Idea and through the AHA's work in the Institute for Precision Medicine, we intend to answer exactly those questions. First of all, from a patient's point of view, patients really don't know, you know, does a doctor want this information?
Right.
Is this important? And I think oftentimes patients and their families, you know, have a lot of information that may not even be tracked or sensed, you know, in a device about, you know, how people are feeling and what their reactions are and, you know, drug side effects and stuff that never gets captured in a way that is meaningful for clinical practice. So what we're trying to do is to figure out with some information, how can we provide a mechanism that is provided to the healthcare provider by exception, instead of sending, you know, hordes of data,
every step you
took,
heartbeat.
you know, every morsel of food you ate. What if you had exception reporting that went to a healthcare provider that might allow action to be taken at that point? Would that be valuable? By the way, how do we even know that the data we're measuring right now is actually even the right data?
Yeah, or relevant.
Or relevant
they
data.
Found that pedometers don't really, in some ways, haven't been as successful as we've hoped in actually creating weight loss, which I think was very surprising to a lot of people.
Very surprising. And when you look at what happens in the traditional physical exam of a patient, the things that are measured have been measured that way for decades.
It's true.
So what is it that really needs to be measured to understand this issue of wellness, health, and well-being? Those are the things that we intend to create through One Brave Idea.
I think this is an exciting time. Thank you so much for speaking with me, and good
you.
luck with all of your endeavors.
Thank you so much.